Hello and welcome to our special podcast dedicated to raising awareness about breast cancer in South Asia. I'm Dr. Tehzeeb, and with me is Dr. Hina Jawaid, who is Associate Professor of Family Medicine Department at the Health Services Academy, Islamabad, Pakistan. Today, we are diving into an important and often undiscussed topic that affects millions of women and their families across South Asian region, particularly Pakistan, and it's a global problem. October is Breast Cancer Awareness Month. It's a time when we come together to educate, support, and advocate for those impacted by this disease. In this episode of our podcast, we'll be exploring the unique challenges that are faced by women in South Asia, discussing the importance of early detection, and highlighting the incredible work being done by healthcare professionals and organizations to combat breast cancer. We'll talk about some common myths and provide information on how one can be involved in raising awareness and supporting those affected. So let's start by asking Dr. Hina our first question. Dr. Hina, tell our viewers about the early signs and symptoms of breast cancer that clinician and patients should be aware of.
Okay, thank you very much for this very important session and the podcast. And I think as clinicians, it's our duty not only to keep ourselves up to date with the information, but share that information among our colleagues and also the students and the population. Breast cancer, one of the most common symptom is a lump in the breast. However, there are other symptoms associated with it. The lump can be either with a pain or it could be painless. Patients can complain of discharge from the nipple. Now, discharge could be something which is like an infection. So there can be a discharge of pus. There could be a discharge of blood or blood mixed with pus. But if you are suspicious of the discharge, if it's not something normal for you, or if you notice any skin changes in the nipple, areola, or the breast skin, the skin changes could be, again, a redness, swelling, warmth, increased dimpling of the skin, anything on the breast which wasn't there before. And that brings me to an important point that self-breast examination is essential. So anybody who's, say, in their teens and above, like 15 and above or 18 and above years of age, we recommend that they check their breast regularly so they know what's normal for them. So checking of the breast includes not only examining yourself in the mirror, so looking at things like whether there's a symmetry, because asymmetrical breast patient may complain of. Sometimes the asymmetry is normal. And people know that when we examine them, they say, yes, one breast is larger than the other. So it's necessary to be aware what's normal for you. So the size, the shape, as I said, lump, any skin changes, any discharge, any lumps in the armpits. So examination of the breast has to be combined together with examining the armpits. And there's a specific way of examining the armpits. What I would recommend to the population is to make yourself aware of it. Utilize any of the breast cams that you get a chance to visit. And because now the breast cams that we do and the sessions that we arrange, self-breast examination is part of it. And those who want to, they can be assisted by a trained nurse or a doctor on how to examine your breast. So armpit is an important area. There are about 5 or 6 places in the armpit that we look at and we feel. So not only examining, but feeling. Lump can only be felt. Rarely it's large enough to be observed or seen by the naked eye, but it's usually felt. Also, breast is examined in 2 positions. So some lumps are more prominent when you're sitting, but majority becomes more prominent when you're laid down. So remember, breast is examined in 2 different. So if you divide a rounded structure into 4 parts, there's a central part, which is the 5th part, and then the outer parts. So make sure you examine and feel every quadrant of it so you don't miss any important areas. The last thing that we see is the area above the clavicle bone. So sometimes the glands in the area above the clavicle bone, they become prominent. So just for the sake of completion, when we are examining the breast or advise somebody to examine the breast, we ask them to examine the breast itself, the armpits, and the area above the collarbone. So you shrug your shoulders a bit so you can feel, push your fingers inside just above the collarbone and feel for any lumps. Again, with the monthly cycles, there are changes in the breast in the reproductive age in any female. So some females who normally examine the breast, say once a month, they will identify that there is some lumpiness in the breast and that it is normal. Sometimes, on a lot of occasions, females come to our clinics and they are really worried, oh, we have felt a lump. And we usually advise them to examine the other side. If the lump is present in the same quadrant on both sides, and that is more likely to be something normal for you. And same goes for if you're noticing any skin changes around the nipple. Sometimes patients can present with cancer, unilateral, one-sided itching, or skin changes, eczematous, dry, excoriated skin, or because of the leakage from the nipple, even if it's a clear discharge, there is itching. It could be something normal, but there is some process going underneath which needs further exploration. So there is a whole set of symptoms and signs, and hence the awareness sessions are important, just to reiterate and revise, make them aware that if you're worried about anything which is not normal for you, it's always best to get it checked. Yeah.
Thank you, Dr. Hina. Yeah, there were some questions that I was that were in my mind, but you've already addressed them, and that's about the monthly changes that happen in breast and how the breast changes during a monthly cycle. So, if there is a breast cancer, and if it is untreated, so can you explain what happens to that?
Okay, if the breast cancer is unfortunately particularly in areas where the literacy levels are low, where the medical facilities are not well established, and people are not generally aware about their health conditions, they present quite late. And one of the topmost thing is the fear factor in the individual herself. First, there is a kind of denialism. Oh, there's nothing wrong with me. It's okay. It will go away. So the lady doesn't tell anybody. But when it starts to get big, um, sometimes with huge infections requiring treatment of the infection and further investigations, and then it delays the entire process. Things like at the moment, weight loss spread to the vertebra, sometimes into the lung. So the risk of spread and into the liver also. So our biggest worry with any advanced case is it only the breast that is involved, or do I have to scan most of the body to check, including the brain? Metastasis can happen in the brain as well. Metastasis means the spread of cancer cells into other parts of the body, away from the primary organ. So it just adds to more investigations, more possibility of a poor prognosis and reduced survival chances and increased risk of mortality. So I think the message needs to go out to the rural-based population, which is predominantly in our country, 70% of it, around 70%, of what to do, to be aware of. So the awareness need to start from things like, if not 9th or 10th grade, then at least from the college.
Okay.
But considering how much of our females to the college, we have to address it to any female who has entered into the pubertal phase. So that population should be the target for awareness. If we have to reduce the number of cases diagnosed as cancers in the future. I'm talking about the future. What has happened. But in future, if we want to reduce the prevalence, the frequency, the incidence, then maybe this strategy will work.
Thank you, Dr. Hina. That's the great point that young girls at puberty should be made aware of breast cancer. So what are the primary risk factors for breast cancer?
Okay. The risk factors for breast cancer, okay, obesity, or very commonly seen with obesity is a condition called metabolic syndrome, which incorporates things like obesity, raised waist size, insulin resistance combined with high blood pressure, hyperlipidemia. And mind you, things like metabolic syndrome not only puts you at a high risk of breast cancer, it also puts you at a high risk of colon cancer, which is intestinal cancer, endometrial cancer, which is lining of the womb, and liver cancer. So just one risk factor is making you more prone to so many cancers. Having a positive family history. But let me clarify one thing here. Majority breast cancers happen by chance. 10% are due to family history. And I would like to address a couple of things here. One thing for sure. I've seen younger females, for instance, if the mother has got a cancer, and she's got, say, 2 girls, and they're grown up in their teens or early 20s, they've come up with comments like, oh, I'm at risk because my mom had cancer. And you can sense a bit of a complaint or a blame in the tone. But let me clarify. That's why I've started when I say family history. I don't want you to go out and start blaming your family for it. But for breast cancer, only 10% cases are due to family history. Majority, 90%, are sporadic. They happen by chance. They happen in people who never had any family history of cancer or let alone breast cancer. So another risk factor is nulliparity, which means not having any kids, or if you're older than 30. Now, the cutoff of 30 years is important as a clinician. What I teach and practice in my practice is, if any female is coming with a breast lump or any changes like discharge, skin problems, or glands in the armpit, and if she even doesn't have any other risk factor like a family history, she's not a smoker, she's not obese, she's not on things like combined oral contraceptive or HRT, refer her, because 30 is a cutoff where we tend to refer. Less than 30, the referral is based on whether if a female, she's postmenopausal age or a premature menopause and she's on HRT. And if she's on HRT for long, like 3 years, 5 years, then the risk of breast cancer increases. Obesity, we have already talked about. In particularly related to Pakistan or low middle income countries, intermarriages, it's a risk factor in our setup. So with families where there is a history of cancers, not only breast, but other cancers, you are increasing the risk. So do consider when you're marrying within the family. Unregulated food industry, there are a lot of carcinogens and chemicals in a pre-prepared food packaging and stuff. And if the quality standards are not maintained, then they become more dangerous for health. So not only cancers, but also for other issues like malnutrition. And the other thing that I specifically want to mention is low levels of vitamin D has been associated with an individual having a high risk of breast cancer. So general health is more important the healthy you are. And by health, I mean cutting down any excess sugars, excess salt, excess weight, excess fats, a healthy diet. That's very important for you. Because excessive intake of sugar has been associated with increased chances of recurrence. And I've seen a number of females who have recovered and survived breast cancer successfully. They are so cautious about their diet, particularly sugar. And it takes a lot of willpower kind of control. There's a temptation in sugars and delicious desserts, but it takes a lot willpower to stop yourself from not having it. Because once you have experienced the pain and the whole the journey that you've been through, it's always best to be cautious. So yeah, these are some of the risk factors. Other risk factors are which we cannot change is the gender. So being a female, so if you compare, don't get me wrong, males also get breast cancers, but it's very rare, right? So compared to men and women, the disease is 100 times likely to be common in females, right? So
Yeah.
you can see the comparison. If
Mm.
somebody has prolonged reproductive cycle, she's had early menarche, say before the age of 10 years, and she has a very late menopause. The average age of menopause is around 51 years. So say
Mm-hmm.
if a female has a menopause at around 55, and
Mm-hmm.
she started periods very early before the age of 13 or 12, then the reproductive cycle or the periods she's having is prolonged. So having a prolonged periods is also risk factor is age. We cannot do anything about age. So age is which is a non-modifiable risk factor. So as you age 40 and above or 50 and above, your chances are high. If somebody has a breast cancer in the past, that is again a risk factor. It puts you at a risk. If somebody had an ovarian cancer or endometrial cancer in the past, it puts you at a high risk. Alcohol consumption in populations where women consume alcohol is also that, because it's important to ask them in the history. If they have a family history of cancer and it was BRCA1 and 2, or another one called P53, then you're at high risk of cancer. So these are some of the risk factors which I would like to mention.
Thank you, Dr. Hina. I mean, they're quite detailed risk factors that you've mentioned, and quite a lot. So what screening methods do you recommend for early detection of breast cancer?
Okay, so considering Pakistan, which is a low middle income country, I think we have to start with something which I mentioned earlier, breast self-examination. It has a very low sensitivity, about running in 20s or 30s, 30% or something. But it is a method or a modality we have to use, because we are not in a position to offer screening to the entire population above the age of 40, or anybody under 40 who's high risk. So self-breast examination to start with, know what's normal for you so you can pick up what's abnormal. Then clinical breast examination. So if you identify something, you go and meet your doctor and he or she examines you. Mammogram, which is like an X-ray of the breast, again, taken into different positions. That also picks up things like calcifications or any opacifications, or there are various changes that you can interpret on the mammogram. Ultrasound scan, it's particularly useful for things like cysts, fibroadenomas, which are benign. So ultrasound can be used as screening. And as I said, MRI, magnetic resonance imaging, again, not readily available, very expensive, and offered in certain centers. The ordinary population hasn't got access to it, and there's no provision in the public sector healthcare facilities. And then there are other ones like PET scanning, which is positron emission tomography, and other fancy ones, which are, again, not available in this part of the world or available to a very small population. So the simplest thing is breast self-examination, and I would like to focus on that through this forum, basically, for women to be aware.
So, Dr. Hina, self-breast examination, and you were talking about screening. What age group women should do breast examination, and what is the screening age in Pakistan?
Okay. The screening age is like not only in Pakistan, but and I would recommend it to do it monthly. The period, I know some people tend to develop tenderness in the breast, but that's again normal for them. If it's happening with every cycle, then it's something which is normal for them. And people are advised to take non-steroidal anti-inflammatory if they don't suffer from any allergies, heartburn, or asthma, or other painkillers are available. So lumpiness, check for that as well. But it's best to check just before the period. And
Okay.
once the period is over, you can recheck it. If you're worried about anything, you recheck it at the end of the period. Even when the period is settled, give it another couple of days and then examine it. So you will identify that the breast has become a bit softer, less tender. Some of the lumps have disappeared.
Mhm.
Yeah.
And so the age of breast cancer screening, is there any official age of breast cancer screening in Pakistan?
We usually recommend 40 and above.
Okay.
In certain parts of the world, it's 50 and above, but because in South Asia, we have the highest mortality. So Pakistan, I mean. So yeah.
Okay. And you were talking about these different screening methods. So how accessible are these screening methods? And when I'm saying accessible, I not only mean by availability of the services, but also cost. So are they free of charges, or are there any costs that patient incur?
Okay. The mammogram, let's talk about mammogram. Mammogram is not free of cost. It, there are certain, at times, particularly during the month of October, there are offers and they are offered at a low price. But even then, that costs something like minimum 3,000 rupees to 5,000 rupees. And not everybody is in a position to pay for it.
Yeah.
But there are methods where people, they're not always aware that there are other possibilities. They can get a further reduction or completely waived off. They are not aware of that. So what I would still encourage women or of any age group who are in the reproductive phase to do come out and do identify. It may be that you have to navigate yourself without any signposting, but if you do come out and can be assisted. I know patient navigation doesn't exist in our setup much, purely because there is no robust primary care system. There is no physician sitting in the community explaining, making population aware or educating them. So they are left on their own to identify what is what, who's who. And at times they end up with quacks, which are not qualified doctors, which is
Yeah.
again an unfortunate situation where patients' time is wasted because they were not aware and there was nobody to guide them. So do the homework robustly. Do go out, check and cross check, and always ask as many people as you can, and try and
Mhm.
focus on how you can be helped. I know it's something which is a responsibility you are taking, but it's your health at the end of the day, so it's important to be aware.
Yeah. Uh, Thank you, Dr. Hina. For instance, a patient is diagnosed during screening, and you think that that patient need treatment. So, what are the standard treatment options available for breast cancer patients?
Okay. So if you've identified a lump, you need to go, and if you've seen the normal regular doctor, then you need to go to see a breast surgeon or a general surgeon. Um, and be mindful that you may not have access to a female breast to see a male surgeon. So
Okay.
be mindful, be aware of that. That's a possibility. Unfortunately, we do not have many female general or breast surgeons. The number is increasing, but we haven't got them available for every population. And then they may refer you to a specialist like radiologist to have more tests, scans, or an oncologist, depending on what they find. So the breast surgeon or the general surgeon will examine you, himself or herself, and then they will recommend investigations like If you haven't had a mammogram, you will be asked to have a mammogram. If you haven't had an ultrasound scan, you'll be asked to have one. And based on what the findings are, you may need another procedure, which is called putting like a needle inside the breast onto the lump or in the lump and getting some cells out to see if it's something which is benign, which is, say, a safe lump, or a malignant, which is the dangerous lump, or the one that has the risk of spreading. So these are the initial procedures. And then depending on what the findings or the tissue findings or the histology, where we look at cells under the microscope, whatever that report tells us, at times you're asked for specialized tests as well. So estrogen receptor and progesterone receptor, and the genetic testing like BRCA1 and BRCA2, which obviously are expensive, and not everybody can afford it. But that is something which is a step two. It's important to get it checked and be able to get done what can be done. There are hospitals which can offer these tests free of cost and or at a low price. So I would advise not to give up just because there's a barrier in terms of finance coming. Do explore the options. They are always there. There may be people in the same shoes as you who have been through it. So connect with all those people who have gone through the same experience. They may be able to guide you better. So, yeah.
Thank you, Dr. Hina. And I think that was my next question, that what facilities are available that cater to these patients, meaning hospitals. Are there any free hospitals or not? So
Yeah.
thank you for that information. So now coming to the awareness of breast cancer, there are a lot of myths and misconceptions around breast cancer. So what are some of the common myths and misconceptions that you hear about when you are in your clinic and patient come to you?
Okay. The first misconception would be that I would like to address is, and it usually comes from females who have been to traditional healers.
Mm-hmm.
Well, not in every case, the breast may not need removal. That is why the staging and the processing is important and investigation is important, because in the first step would be to preserve as much as possible and just remove the disease part. But
Okay.
there are conditions, there are stages of cancer where we are not able to, and then that is the last resort where you have to remove the entire breast.
Yeah.
But then there are options like implants are available. Again, people do worry about the finances and stuff, but it's always best to explore options.
Yeah.
You may find an option which is acceptable to you, that's reasonable for you, and you can get to that point. So don't take any negative thing as something which is like the final and you've hit a brick wall. It doesn't happen that way. So be open about all the options and talk about them. Sometimes then they come and say, oh, my other breast will also be removed. The prophylactic removal is a separate thing, and it's not done in every case. They are done in certain cases, but again, it depends on patient's consent. And they are done because we are there to give you a cancer-free period, reducing the risk of chance of recurrence. Because as long as you have the breast tissue, the chances of recurrence is there. So
Yeah.
that needs to be minimized. So these are usually some of the, then breastfeeding. Oh, I didn't breastfeed my child, that's why I have developed. We've seen a number of cases where females have breastfed and they have developed cancer. So again, these are some of the things. I've never smoked in life, I've never drunk alcohol, and I've got cancer. As opposed to that, there are a number of people who are passive smokers, which means they've never smoked themselves, but they have inhaled the smoke from other people and they have developed breast cancer. So there's always another side of the story and the other side of the coin that needs one to be aware of. So if you're getting any thoughts within your own mind or induced by people around you, relatives or friends, get them checked. Always ask, always check. Deodorants, mobile phones, and wearing a bra can cause a breast cancer. Again, there is no evidence to support that these things can cause breast cancer.
Thank you, Dr. Hina. And as you also said that people who have breast cancer, so one out of nine without
Yeah.
any family history of breast cancer will have it. So it's not that always you have a family history, you'll have breast cancer. So I think we are at the end
Yeah,
of, yeah.
sorry, the figure that 1 in 9 Pakistani women are at risk of breast cancer at any stage of their life, basically. So if 9 women are standing, 1 is at risk at any age or stage of their life. That's now increased to 1:8. And mind you, this figure, the original figure of 1:9, is this figure is quite old. So it was first, it came to the surface in 2007, and it's still being quoted considering we are in 2024. And that again itself speak volumes that how much is there a need for a cancer registry and having to know the numbers of identified cases per year and how many people lost their lives or had the morbidity. Yeah.
So you're right. I mean, in countries like I'm based in Australia, so we had lung cancer, which was pretty high. So that was the
Yeah.
number one leading cause of death. But now we have breast cancer because with the number of lung cancer declining, the breast cancer has taken its place. And I think that similar situation would be in Pakistan also. So
That's
how
right.
does cultural factors play a role in breast cancer awareness and treatment in Pakistan?
The answer to that is a yes. They do, because right. Okay. So the awareness, we talk about awareness outside our homes, but I think it needs to go inside the homes as well. So talking about things like these within the family is important. So cultural beliefs, yes, there are there. Let's not talk about such things. And I think that just delays the process. You can't hide the facts, basically. The fact remains there. Illiteracy problems, treatment affordability, lack of support from the government on cancer patients and their journey is again about 64% of our population is rural based, so lack of healthcare facilities. And as I mentioned earlier, the early detection thing is missing, in addition to poor screening. So these are all in addition to culture being the barrier. But at the same time, compared to many years ago, a lot of awareness has penetrated into the population, and they are getting aware, but we still need to get past some of the barriers of the lack of encouragement to speak about these topics. Yeah.
Yeah. And I think one of the another thing is about the unmarried girls, if they get breast cancer, whatever age they are, they're also very reluctant to consult the medical facilities.
Yeah.
So, yeah, anything you want to add about that?
Just one thing which is very much recent is those people who have got access to mobiles and they can download apps. Then breast cancer apps are there, and they are very good ones. They are either animated and there's a voice note which tells you how to examine, what to look at, and it gives you a reminder as well every month that it's time to examine your breast. So those females who have got access to mobiles where they can download apps, then perhaps they find it useful. Yeah.
I think that's a great way of reminders and health education and awareness raising. All right, so we're concluding our podcast. One last question. So, what key messages would you like to convey to our listeners about breast cancer?
Um, as I said, be aware. It's important to be aware. And it's not only about the breast cancer, it's about the society you live in, and anything that's related to you, your own good, your own health. You have to be aware of it and always spread the knowledge, because when we conducted a study where we did a session on breast cancer. We checked the awareness prior to the session and after the session. And the figures that we obtained were significant in terms of the level of awareness that one breast cancer session can give the audience. So always, if you get an opportunity, go out, grab that knowledge, apply it on yourself, spread it to the others. And that would help. Yeah.
So that study did that involve patients or healthcare providers? The study that you're talking about.
Okay, it included the final year medical student, the nursing staff, and allied healthcare workers. So there were 3 different cadres. They were all related to medical sector. So they were involved, and so we did a pre-session and a post-session analysis. And the other thing, since I've been doing the breast cancer awareness session since 2017, I've realized that it's important to get the male participants in these talks as well. They need to be equally aware, and it's important that they. So misconception that a breast cancer session is to be attended by a female only. About 17% of the audience in our sessions combined together were males who attended. 83% were females, but 17%, which is a good number, were males as well. So yeah.
Yeah, so that brings me to one of my observation is that so it's not only the general public that needs education, it's the health professional also that need further education on breast cancer. And yeah, you're 100% right about the male health professionals also. So thank you very much, Dr. Hina. I think we've covered everything that we thought that we will, but if there is anything that you think that we haven't covered, so just tell us.
Okay. No, I agree. We have covered most of the things. So just to reiterate, as I said, be aware. There are certain treatment options for breast cancers, which your doctors will be able to tell. So breast preservation is a possibility. So if you're worried about anything, it's best to get it off your chest and ask the question rather than to be in the fear of within yourself. Just let it out. Yeah. Thank you.
Thank you very much. We'll hopefully meet again next week, talk about another topic. But for now, thank you very much, everyone, for listening to us. Thank you.